Welcome to the Diabetes Podcast. Today we're diving into a topic that causes confusion, frustration, and sometimes heartbreak. Type 1.5 diabetes, also called LADA, or latent autoimmune diabetes in adults. If you've ever felt like your diagnosis didn't quite fit, if you've been told that you're type 2 but the treatments aren't working, or if you're wondering why your doctor is suddenly talking about insulin, this episode is for you. We're going to unpack what LADA really is, why it's so often misdiagnosed, how it affects real people, and most importantly, what you can do if this is your story. Because the truth is, it isn't just about lab values or test results. It's about living between two worlds, type 1 and type 2, and the emotional toll of not knowing where you belong. Let's go. Hello and welcome to the Diabetes Podcast. I'm Richie.
And I'm Amber.
And Amber, on most of the podcasts, we focus on type 2 and pre-diabetes remission strategies. Today, we're talking about something that I was pretty much unaware of until just recently, latent autoimmune diabetes in adults, often referred to as LADA. Sometimes it's referred to as diabetes 1.5. Amber, tell us all about it.
Well, I think I will start with asking you to use your imagination. Just imagine that you're in your late 30s, early 40s, maybe, and you've just been told that you have type 2 diabetes. You start medication, maybe metformin, maybe an SGLT2 receptor inhibitor like Jardiance or Farxiga. You're eating healthier, you're walking every night, but your blood sugars are just not moving. Month after month, you go in, the doctor adds more meds, you feel like a failure. And then one day, a specialist runs an antibody test, and suddenly the story changes. Turns out you don't have type 2 at all. You have latent autoimmune diabetes in adulthood. So this is an autoimmune disease, just like type 1, where the immune system is attacking the beta cells of the pancreas. Those are the insulin-producing cells of the pancreas. But unlike type 1, which is usually diagnosed in childhood, it develops slowly, and you might not need insulin right away. But it's that overlap with type 2 that makes it really tricky. Same symptoms: thirst, fatigue, weight loss, high blood sugar. But the root cause is quite different. So it's not because there's anything more you could have done, like you ate the wrong food, you skipped the gym. This is your immune system attacking those insulin-producing cells of your pancreas. Has nothing to do with willpower. So this tends to show up in adults, usually between ages 30 and 50. Not a hard rule, because it can definitely be diagnosed outside those years as well. But what really makes it confusing is that it doesn't look like the classic type 1 diagnosis as a child or the classic type 2 in someone with metabolic syndrome. Namely, people with latent autoimmune diabetes are not overweight. The BMI tends to be around 22, 23, which is in the normal weight body mass index category. Typically don't have high blood pressure or high cholesterol at diagnosis. Now, the cholesterol could be really high after diagnosis because of the increased risk of cardiovascular disease with a higher A1C that most people with latent autoimmune diabetes have. So the familial history is different. Studies are kind of showing a little bit different things. Some say a family history of type 2 is also a history. Other studies don't really show that. But usually if there's a family history of autoimmune disease like thyroid disease, celiac, rheumatoid arthritis, those tend to signify that you could be at risk for latent autoimmune diabetes of adulthood.
You mentioned earlier that this is slower progressing than
Mhm.
type 1. Is it really just that it manifests slower, or are there environmental triggers later in life that cause this to kick in later?
I mean, it's definitely autoimmune, and it could be an autoimmune trigger, as is the case with type 1. I think what's interesting is that usually the onset of someone with type 1, that median age is around 12. Usually people are diagnosed prior to age 16 or 18, the median being about 12 and a half. But it's kind of, again, in between type 1 and type 2 people with LADA, in that the median age is usually around 33 versus type 2 diabetes where the median age is 48. So
What's
yeah.
causing this diagnosis at that time? Are there symptoms that people are experiencing that
Mm.
has their doctors running blood panels, or what's going on there?
Yeah, a lot of the same symptoms as someone would have with type 2: frequent thirst, frequent urination, fatigue, being tired. All of those are showing up very much the same. And most people with latent autoimmune diabetes go years before they get the right diagnosis. They're told you have type 2. Most people are, because they're um, diagnosed in adulthood, they're misdiagnosed. And about 10% of adults diagnosed with type 2 diabetes actually have latent autoimmune diabetes of adulthood. And
But
what,
hold on,
yeah,
can you say that number again?
yes, 10% of people who are diagnosed with type 2 diabetes actually have type 1.5 or latent autoimmune diabetes in adulthood. And it's kind of skirting between the two of those
So
things.
just ballpark numbers, doing some math. If we're at about 250 million adult Americans, and about the most recent numbers I think suggest about 13% of those have type 2, then really we're talking about a little more than about 3 million Americans are probably experiencing LADA. That's not an insignificant number
No,
of
I
people.
I I see quite a few people. I mean, I definitely, in the diabetes world, you've got your, because yes, I have worked with type 1 diabetes and children, but most of my work in diabetes has been in the adult world. So I see people who have type 1 and have had type 1 since they were age 3 and 2 and 6 and 12 and 14 and 16. And then I see people who are diagnosed with type 1.5 at age 45, and it really blindsides them, because in the literature, and I've seen this in my clinical experiences, that people with type 1.5 tend to have much worse A1Cs than people with type 1 or people with type 2. So, like, typically, people with type 2 will have a certain A1C, and then people with type 1 might have a little bit higher A1C as a whole. There's a whole spectrum, because people with type 1 need insulin, and if they aren't taking it, their A1Cs can be 12, 13, versus people who take really great care of themselves, A1C 6 to 7.
Yeah.
But the median tends to be higher than those with type 2, because you have a lot of people um, who are on type 2 with metformin, very well controlled, A1C 7, 7.2, and just the vast numbers of those pull that A1C down. But then with latent autoimmune diabetes, you have A1Cs that are higher than both type 1 and type 2 as a whole. And
Is that
yeah.
just a function of, we've talked about most adults at diagnosis of type 2 are probably at, let's just say, half their functioning beta cells. Whereas I'm assuming, if you're diagnosed as type 2 and you actually have LADA, that number's dropping off pretty quick,
Absolutely.
right?
Yes, yes.
Okay.
And many people with LADA, as I was saying, they go for years before they get that right diagnosis. And they're probably, I haven't seen studies on this, but in my experience, they tend to be more frustrated because it's like just more and more and more meds, and the A1C just goes up and up and up and still isn't controlled. And in the meantime, their pancreas is losing functioning beta cells.
Right.
And it's so frustrating for the patient, but it's also really dangerous because they could end up in diabetic ketoacidosis. And it tends to be that people with latent autoimmune diabetes, for whatever reason, tend to be a higher propensity towards males than females. And if you look at the risk of diabetic ketoacidosis, it tends to be higher in males, around that latent autoimmune diabetes in adulthood diagnosis age. So it's very
Well,
interesting.
can you talk a little bit more about diagnosis of LADA? Because I mean, again, I'm definitely the layperson here. This sounds like it's almost impossible to get right initially. Like, I mean, like at the time that it's kicking in, it seems like it's almost uniformly going to be diagnosed as type 2. Is there something that can be done to do a
Yeah.
better job of getting this right?
Yeah, there's a couple of things. As I said before, people with latent autoimmune diabetes typically are going to have a normal body mass index, whereas people with type 1, number one, people with type 1 are going to be diagnosed usually around age 12. And so if someone has made it into their 30s or 40s and they're being diagnosed, you have to kind of look at, is that potentially type 1.5?
Mhm.
Because most people with type 2, it's going to be age 48 or higher. And the number one risk of type 2 diabetes is age 65 or higher. So age is really correlative to type 2. So if somebody is kind of in that age range and their BMI is normal, that kind of should be a little question mark, like to get different tests done to study for this. Like you can test for autoantibodies, you could do a C-peptide test, and I would highly recommend that to distinguish between, is this somebody with type 1.5 or type 2?
Okay. You talked about this being misdiagnosed as type 2. Is that strictly tied to just the A1C being in that range as opposed to being diagnosed as like prediabetes? The question I'm trying to get to, or the answer I'm trying to get to, is it does this kick in relatively quickly, or has this been slowly progressing since I was, in my teens maybe? And is it possible that this person would have had a diagnosis of, say, like prediabetes in maybe their late 20s, but nobody's thinking about their health in their late 20s? Is that, does that make sense?
Pre-diabetes is more pre-type 2 diabetes.
Right, right. But there's a
Yeah,
there's an A1C range associated with prediabetes as opposed to type 2 diabetes,
yeah.
right?
Well,
It's a 6.7, I believe, is where it starts to get serious. So my question is would a person with LADA, would they see that kind of pre-diabetes range in maybe their earlier 30s or their late 20s, or is there just not really a lot of, data to support one way or the other?
that's a good question. I can't say with any certainty an answer to that question. I think usually when somebody is diagnosed with latent autoimmune diabetes in adulthood, they're going to need insulin pretty quickly.
Right.
And if they don't get insulin, then they're falling into that category where they have a higher A1C than people with type 1 or type 2, which is why it is very important if you're if you're listening to this and your A1C is higher than you think it should be, or you're at an age younger than 48 and your BMI is normal, that would be, I would request an autoantibody test. And if your physician isn't familiar with which one, I would definitely see an endocrinologist, because they would be. And you're looking for these GAD antibodies, which are glutamic acid decarboxylase, which doesn't really matter. But GAD 65 is going to show up positive for most cases of LADA. So 70 to 80% of cases are going to test positive. And that's the slower progressing. And I think this is where your question came from, is that it is a slower progressing autoimmune, in that whatever trigger was there gets turned on. You know, like you have, it's kind of, genetics are very interesting, because often you have these dormant triggers,
Right.
and then something sets it off, and then you're there. So it is slower progressing than type 1. However, these people do tend to need insulin pretty quickly, but that, you know, having LADA is strongly linked to that GAD positivity test. And
I got a question. So
Yeah.
how long, in your experience, from initial diagnosis of type 2 to correct diagnosis of LADA, how long does that usually take?
oh gosh, I don't know. I haven't seen studies on that, but I would say, like, if you're diagnosed with type 2 at age 42 and you're maybe slightly overweight, maybe your BMI is like 25, 26, the first step would be to double check that diagnosis with that GAD antibody test, because there's like a 10% chance that it could be latent autoimmune diabetes in adulthood. So then,
I guess what I'm getting at is,
yeah, what are you getting at, dude?
Okay.
What
I'm
are you asking?
I am the lay person. You know, I've got anecdotal stories from people that we've worked with. But my understanding is, you know, you get diagnosed with type 2, they're not putting you on insulin right away. You know,
No.
they're
Right.
probably going to prescribe some metformin or something like that. And in this particular case, you know, we beat the drum of make your body work better for you. Try to do all of the things you can do to, you know, keep your little beta cells happy. Let's take some of the load off your pancreas.
Yep.
That's not going to be adequate for folks with LADA. There's very much
Right.
they need to know how functional their remaining beta cells are, and then really
Yep.
very quickly need to get onto insulin to make up for, you know, the guys
How
that
do you
aren't
know that?
producing. What's that?
How do you
How
know
do I
that?
know that? Okay, tell me I'm wrong. They're
Not
running at
telling
half
you you're
they're
wrong,
running
but
at half capacity
you've
because
been
their
listening
body
to
is
somebody like
attacking
me.
their own beta cells. So
Yep.
this isn't a I'm overworking my pancreas. This is my body is attacking my pancreas. And I
Right.
need to medicate appropriately for this disease. But I guess what I'm getting at is the normal rollout of countermeasures for type 2 diabetes is not going to be appropriate for LADA, or at least not ideal. And
Yeah, and that's
how long do I keep going with a bad plan before I realize, oh well, crap, I need to do something different? And that's really just leaning on your experience. I mean,
yeah, but I
you've
mean, that's exactly the frustration, because if you, the layperson, which you're learning more than just the layperson, the fact that you said early initiation of insulin is like you've been paying attention, sir. It's a proud moment for me to hear you say that. Sorry. No, so like the average person is not going to say, well, what if I have autoimmune diabetes in adulthood? They don't know that this exists. It's type
nobody
2.
knows that this exists.
A couple people do, but yeah. And in the studies, about 60% of people with type 1.5 or latent autoimmune diabetes in adulthood were actually on an oral anti-diabetes agent. And Maybe it was helping a little because most Americans at least are going to have some metabolic dysfunction, very likely, just due to our lifestyle choices typically. But yeah, it's not going to stop that autoimmune attack that's going on. And so, like I said, if what you're doing isn't working, you could get your antibodies tested, and you could also have a C-peptide test. And this is something we've talked about before too, just getting that C-peptide level, because then you would know how much insulin your body is still making. Because that if you end up delaying insulin, then you could have those prolonged high sugars, which is a higher risk of long-term complications of diabetes. So you're going to see, if you have insulin resistance, which you would have a higher C-peptide level, versus insulin deficiency. In latent autoimmune diabetes, you're going to have a lower C-peptide level. So like yes, the course is, if you're type 2 diabetes, if you are someone who has type 2 diabetes for real, not latent autoimmune, but type 2, you would start with lifestyle and metformin. And this is kind of where people run into trouble and can have much higher sugars than they need to. And also why clinical inertia is so bad, because if you give someone 6 months to try lifestyle and metformin and their latent autoimmune diabetes in adulthood, the path that needs to be taken shifts, because, as you said, that early initiation of insulin may help preserve what's left of beta cell function and really get those blood sugars into control early on before those long-term complications take effect, versus type 2, where you've got lifestyle metformin. You're looking to lose 5 to 7% of your weight. But if your body mass index is normal, as it would be in latent autoimmune diabetes, what weight exactly are you going to lose? And in that weight may or may not have an effect on blood sugar numbers. And most of the time it's going to be that it won't. Whereas in type 2, you could see a huge difference in blood sugar control with just that 5 to 7% weight loss. And then you could add an SGLT2 or GLP-1. But if you've added that, if you're listening to this and you've added those medications and your A1C still went up, definitely get those tests to see, because there's a 1 in 10 chance that it could be latent autoimmune diabetes of adulthood. Because the goal is protect the pancreas, protect your long-term health, and avoid that trap of, you go to the doctor, they give you more meds. You go to the doctor, you get more meds, because you've really got to address the root issue for the type of diabetes that you have. Does that answer your question, sir?
It does. If I can kind of parrot that back, if within the first 6 months of diagnosis, it does not appear that any of the strategy, and this is also, again, let's just be candid. This is assume you're actually employing the strategies that you're talking about with your physician. In addition to taking your medications, you are implementing the lifestyle changes that go along with that. If you're doing all of that and you continue to see these numbers keep creeping up, it's probably prudent to maybe check and see if there's something additional, if you might actually be dealing with an autoimmune situation.
Absolutely. Because the research is very clear on starting insulin early. Like, you want to have insulin helping out your pancreas while it's still making some of its own insulin. If you think about, if you're really tired, like carrying something, if somebody comes and helps you when you only have 50% of your strength left, that's way better than when you're like done. Like, if you have nothing left to give and somebody comes and helps you, you're still done. And it's the same idea with the pancreas. Like, you really want that early insulin to help preserve beta cell function, because it can help preserve it for years. So instead of burning out the insulin producing cells in 6 to 12 months, Some people, according to studies, can maintain partial insulin production for 2, 3, sometimes even 5 years. And the best outcomes happen when the A1C is still in that 7 to 8% range and before the blood sugars have been running high for a long time. You know, you've got that engine revving at the highest RPMs for a very
Yeah.
long time. That engine's going to break. And the point is not that if you're needing to start insulin, it's not that you're failing or that insulin is a punishment. It's just getting the right treatment for the right condition, because you really have to use this as a tool to protect your body's remaining functions. So lifestyle still matters either way. Like, I don't want to say that because you have latent autoimmune diabetes that eating better, moving more, all of these things, managing your stress, reducing oxidation by having more fruits and vegetables would not be a bad thing. This can still lower the load on your body and improve quality of life. It's not going to stop the immune system from attacking the beta cells of your pancreas, but it can slow it even further. So the main thing is just to get your body the help that it needs with the type of diabetes that you have.
And then I think also for the people that have this, I think whether it's type 1 or type 2, there's a lot of shame that comes with a diagnosis of diabetes one way or the other. You
Yes,
know, just keep in
unfortunately
mind, like,
true.
this is an autoimmune disease, right?
Yeah.
That there's shame's not useful, but
Nope.
action and early action is. Just
Absolutely.
this is your circumstances, and the
Hmm.
quicker you can start applying the correct treatment for the appropriate diagnosis, the better.
Hmm.
I mean, really,
Yeah.
it's the same as pre-diabetes. You know, preserve that beta cell function.
Yep.
Don't
Hmm.
wait until it gets to 50% or maybe less than that. Wouldn't it be great if I could identify this at 10% beta cell
Hmm.
loss and start applying some of the behaviors that take the stress off that pancreas.
Yeah.
That moving after meals, utilizing those GLUT4 pathways to get the blood sugar
Yep.
out of your blood system and into your muscles.
Yeah. I along not to derail from what you were saying, that's all very important stuff. I think what I see a lot of in the diabetes space is that majority rules. And so that's not just the diabetes space, that is kind of life in general. When the majority of something is here, it's like that's what everybody kind of thinks is true, and that's their like, okay, here's my little box of understanding, can I put you into this box? And so a lot of
Right.
times when people, what the layperson understands of diabetes is typically, and things are getting way better in this respect, but typically it's all type 2, and they might know that one person um, that has type 1, but they don't really understand the difference and don't know. And I hear a lot from people who have type 1. um Unsolicited advice is just you know when when I was pregnant, you get a lot of unsolicited advice. I think people who have diabetes are another group of people who get a lot of unsolicited advice. Like, can you imagine you have an autoimmune type of diabetes that you've done everything that you've thought to do in the movement space, in the eating space, and it didn't work, and you have to have insulin to live. And some probably well-meaning person is like, oh, well, my sister's cousin had diabetes and they just went to the gym and ate right and it went away. And I know that we talk a lot about type 2 remission, but we're always very clear to put type 2 in front or behind that, because we are unable at this time to put type 1 or latent autoimmune diabetes in adulthood into remission. Now with type 1.5, you can kind of use some lifestyle things to delay it a little, but it's still the body attacking the insulin producing cells of the pancreas. So try to have grace for people as best you can, that usually they're trying to be helpful and they're looking at the 90% of the world that they know. And I think that if you choose to do so, you could try to educate people, or you could just let it lie. That's going to be your own decision and your own barriers, and not barriers, sorry, your own boundaries. There's the word, about what you're willing to discuss about your own health. Like your health is yours. It doesn't belong to some random person on the street. You have no obligation to explain to them something. Or you could choose to help them understand, so that if this ever happened to them or a loved one, since they're someone who's going to speak out, whether they were asked to or not, maybe it is helpful to someone in the future if they have better knowledge around that. But what I see often with latent autoimmune diabetes in adulthood is there's a lot of identity confusion because they don't fit that type 1 diagnosed early, need insulin group, and they are not fully in this type 2 group as well. So they don't really know what's going on with them. And there's a lot of anxiety about having to take insulin, and just get real tired of having to explain to family and friends why they need insulin, even though they weren't diagnosed as a child. And even a lot of doctors don't really understand. Now, endocrinologists do, but a lot of family care physicians or doctors outside of family care endocrinology don't fully understand latent autoimmune diabetes in adulthood. So they just kind of put it in this bucket of their own understanding. So it's important to have a support team, your endocrinologist, your diabetes educator, dietitian, therapist, your peers. Find a group of similar people to you. And that's, again, where it's hard, because you've got a lot of type 1 groups, a lot of type 2 groups. Where's your type 1.5 groups?
Well, and again, if you don't want to talk about this, this is fine. Almost every single episode, we've talked about lifestyle strategies as a means of remediating type 2. Is it safe to say, if I have a diagnosis of diabetes 1.5 or LADA, I know I'm taking insulin. Does that mean injections? Does that mean pump with CGM? Like what is the best strategy? Because this is now, okay, I'm going to need insulin. What's the best tools available to this population to make this kind of as much of an afterthought as possible? I know the technology's gotten pretty good in the past couple of years.
Absolutely. I mean, in a perfect, so like if Amber ruled the world, let's go there a minute.
I'm personally working towards that. So yeah, let's walk this dog.
Yeah, in a perfect world, if you're of normal weight and age 30 to 48, 50, and you're diagnosed with quote unquote type 2 diabetes, I would get an autoantibody test. I would get a C-peptide level done. And if those showed up with positive autoantibodies and low C-peptide, I would ask my physician about getting a continuous glucose monitor. There's 2 on the market. There's Dexcom G6 or G7, and then there's a Libre 3 Plus. And if you wanted to do an automated insulin delivery device, there are several on the market, all of them tubed except for one, which if it's me, like if I have a purse and I walk through a door, if the strap's too long, it gets caught on the door handle. Like that would not be for me. I would have to do tubeless, end of story. And that would be like with the Libre 2 Plus or with the Dexcom G6 or G7. So one's reading the sugar, one's delivering the insulin. They're communicating every 5 minutes, looking at the blood sugar right then and then an hour into the future. So it's really great It's like having an artificial pancreas on the outside of your body, minus many of the other actions of the pancreas besides producing beta cells. But in terms of just the beta cell production and responding to the blood sugar levels, you have that. So that's what I would recommend. And then right off the bat, A1C is controlled, long-term complications of type 2 are lessened.
With the diagnosis of LADA, are those insulin pumps, is that, the CGMs, is that usually covered all or partially by insurance, or how does that work?
Yeah. So the one in particular that I was talking about that is not tubeless, that would be as a pharmacy that runs through the pharmacy. And some of the others coming out now as well are also pharmacy benefit. Some are through your durable medical equipment. So they come with contracts, and you definitely have to have a C-peptide level in order to get one of those pumps. So to get one of those, you would need the C-peptide. You would need to have this form filled out with all of the questions, and then you would have a contract for a pump for somewhere between $7,000 to $14,000, depending. Usually insurance would cover at least a big portion of that. And with the tubeless insulin system, if you've got commercial insurance, so mostly with LADA, that would be prior to age 65, so you wouldn't have Medicare. And the average copay for commercial insurance is about $30 a month. Okay. But you would also have your continuous glucose monitor copay on top of that. So, every insurance is different. Every person is different. What would be best for you, what your endocrinologist is comfortable managing would be different as well. So basically, if you have the right tools, you get to take control and really write how your story unfolds. You don't have to live with these high sugars. You can help preserve your beta cell function and get the help that you need to control your sugars. So,
but that early correct diagnosis is key.
Absolutely.
Yeah. Okay. Okay. Well, that was a lot about something that I don't think a lot of people are talking about. I don't think that
we just did.
We did. Yes.
Yeah.
There's a lot of rights to wrong in diabetes space, but this one in particular, I hope this really finds an audience, because just doing some research, that there's not a lot of stuff on the interwebs about this. Certainly not from an early diagnosis awareness standpoint. And that seems to be really the most important thing about this, is getting it right early. So,
absolutely.
All right.
All right. Thank you all so much for joining us today. I hope that this was helpful. Episode.
And we will talk to you guys again next week.
Take care.
So that's type 1.5 diabetes, or LADA, an autoimmune diabetes that develops later in life, often mistaken for type 2, but with its own challenges and its own path. If you're living with LADA, remember you're not alone. Find your people, build your care team, and never forget, while you can't control everything, you can take meaningful steps to protect your health and your peace of mind. Thanks for tuning into the Diabetes Podcast. If you found this episode helpful, share it and subscribe so that you don't miss what's coming next. And if you've got questions, send them our way at support@empowereddiabetes.com. We'd love to feature them in a future episode. Until next time, take courage. You can do this, and we can help.